This time of year, you used to only have to worry about getting a flu shot, but things have become a lot more complicated in the past few years with the addition of COVID-19 shots and RSV shots for older adults. Let's talk you through what you should be thinking about as you go into cold and flu season. Hi, I'm Helen Branswell. I cover infectious diseases for STAT. If you're somebody who is only going to make one appointment and wants to get this done with as little fuss as possible, by all means, you can get both vaccines, meaning COVID and flu, or COVID, flu, and RSV if you qualify for RSV. The COVID vaccines that are available now in pharmacies and in doctors' offices are the new updated versions of the vaccine. They're available from Pfizer, Moderna, or Novavax. If you've recently had COVID, you shouldn't get a COVID shot for a little while. The CDC recommends that you wait at least 3 months. Likewise, if you recently had a COVID shot, you need to wait at least 4 months until you get another one. In terms of RSV vaccine, this is a vaccine that is only available to certain portions of the population. People who are 75 and older can get a shot as long as they haven't had one in the past. At this point, this is not a shot that you're supposed to get every year, so if you got one last year, you're not eligible to get another one this year. The shot is also available to people 60 to 74 years old who have some health conditions that make them at high risk of becoming severely ill if they contract RSV. Children who have not yet had a flu shot or a COVID shot, so we're talking really young children here, need more than one shot the first time they're getting these vaccines. They need sort of a primary series. You'll remember that term from the COVID pandemic. If they're getting a Pfizer vaccine for COVID, that's 3 shots, with the 3 shots spaced over several weeks, months really. If they're getting a Moderna, it's 2 shots spaced over, again, several weeks. And for the first time they get a flu shot, they will also need 2 shots spaced over several weeks. Other children, if they've already been vaccinated against these 2 things, will only need 1 shot. Something that's really important is protecting young infants against RSV. This is a really bad infection in them, and it can make them really quite sick. There are 2 options to protect babies. There's a vaccine for pregnant people, which works by generating antibodies in the mother that are then transferred to the fetus in utero. So the baby is effectively born with antibodies on board. Those vaccines can only be given between weeks 32 and weeks 36 of pregnancy, and are only used in pregnancies where that period, that window, will occur between September and January. The other option is something that's given to an infant after birth. It's called Beyfortus. It's a shot of antibodies. That should be given to infants who are born between October and March, effectively at birth, if that's possible, and if not at birth, within the first week of life. For babies that are born between April and the end of August, those babies should be getting this shot in the weeks before the start of RSV season, so typically around the beginning of October.